Thanks, team. Well, tonight's show is all about low thyroid. And of course, Dr. Red will be joining me. But first of all, take a little look at this clip for tonight's episode.
So anyone suffering with Hashimoto's, we're finding out now gluten plays a big role in flaring up the autoimmune response, almost as closely linked to celiac disease as well. So if you have Hashimoto's, there's likelihood that gluten could be like a rat poison for you.
What about wholemeal bread?
The more whole wheat you go, the more gluten it has too, so the worse it's going to be for you. So the biggest thing that we want to focus on when somebody walks into our office is to try to identify the underlying mechanisms that most doctors have missed up to that point.
I was overweight, I was tired all the time. When last year was probably the worst year of my life, I was depressed. I would wake up in the morning just sick, not feeling good. And when I woke up in the morning, all I could do was say, just make it through your 8 hours of work and you can come home and sleep.
Dr. Red, thanks for joining us.
Thanks for having me.
Okay, do you like how I'm matching my cushions?
I love your cushions and I love your shirt.
And you like my shirt too?
Absolutely.
Okay, first things first, low thyroid, what is it?
Low thyroid is when your thyroid, which is a gland in your throat, isn't producing the proper life-sustaining thyroid hormones that your body needs.
What does it do?
Well, every single cell in your body has a thyroid hormone receptor. So thyroid hormones are crucial for pretty much every single function in the body.
Very quickly, a question that a viewer wrote in, what are the symptoms of a low thyroid?
The most common ones will be depression, fatigue, hair loss, inability to lose weight. These patients might also have intestinal problems.
So you're talking about the Troy syndrome?
The Troy syndrome. No, you look great. Come on. You look great. But intestinal problems, they might also swell in their hands and feet, which is really common.
Fat little fingers?
Fat little fingers, or, you know. Yeah.
Can't get your wedding band off, or everything becomes a little bit slower.
Definitely. They'll also see fluctuating weight. These patients will just fluctuate, sometimes within a day, 5 pounds.
Are you serious?
Yeah.
That is crazy. Dr. Red, what is the main cause of a low thyroid?
The main cause is a disease called Hashimoto's disease. And this is when your immune system thinks that your thyroid is a bad thing and starts attacking it to get rid of it. And it destroys the thyroid tissue at a rapid pace and eventually causes a permanent low thyroid. But this is a huge problem because most doctors are just treating them with a thyroid hormone and totally neglecting the main mechanism that's causing the thyroid problem to begin with.
Is this something that has been around for generations, or is it something that we just go, oh, it's just started?
It's been around for a long time, but now we're seeing clinical value of actually diagnosing these patients with Hashimoto's and knowing what's causing it rather than just treating symptoms.
And understanding it more.
Exactly.
Is there more studies out there regarding Hashimoto's and low thyroid?
There's mounds of studies now showing that most of these patients that have low thyroid are suffering from Hashimoto's condition.
I've spoken to other doctors as well that specialize in this.
Yeah.
Why do you stand out from the pack?
I think with our experience, we really understand when it comes to autoimmune conditions. I mean, we have patients from 30 different countries in every state in the nation right now that are specifically working on these patients, And so the biggest thing is we don't want to treat these patients like a protocol. We want to find out exactly what's causing these problems and how to identify what's causing their problems specifically, and then customize a treatment plan that really helps these patients feel better.
So everything is different for every patient that sees you.
Exactly.
So just say I have a brother and I have low thyroid or Hashimoto's, doesn't mean you will treat me the same as he.
They might have different physiological imbalances and different lifestyle and dietary things that cause it to flare.
I love it. Dr. Red, I'm going to make you feel really special now.
I love feeling special. I love it. I love it.
Throw to the team, bud.
Alrighty. If you want to find out more information about low thyroid, make sure and watch the show tonight. Back to you, team.